If you were in charge, right? I mean, and it does. I mean, well, I mean, it does. I mean, frankly, it does really feel like we have a vacuum of leadership on this. We have a daily news brief, I guess you could call that, from the president, who's out there literally yesterday saying that, encouraging people, or just saying, like, throwing it out there as if we were just spitballing on, drinking Clorox or something. I mean, that's sheer insanity. But more to the point is that while he's doing that, there's no one behind the curtain going, all right, this is what we're really doing, and looking at a big board here. And I don't know, frankly, how we get there with this administration. I honestly have no concept of how you can have any type of leadership in this context. But if you were that person, would you say that, like, look, we're going to, there are going to be cohorts that can go out there, I mean, I get a better idea of what you're talking about when you say the baseball, which is like, let's find areas that will minimize the infection. But if we are this active in minimizing the infection, isn't then the end game just a vaccine? I mean, because we could.
Well, the end game is a vaccine. You're absolutely right. The end game is a vaccine. So what I'm trying to do is, it's kind of a three-order effect here. We're trying to hold back the virus. We're trying to keep society from basically imploding as we know it.
Right.
And we're trying to move that vaccine to get us together. So I think that's the combination. But I think, for example, I participated in a meeting where the medical ethicists raised some incredible questions about ventilator use. And we know that, being on a ventilator in of itself is a bad outcome for this disease.
Right.
But the question was, if we have a young man who's a quad, who basically is being kept alive on a ventilator, and he may have X number of years of life yet, but if his ventilator was available over the course of the next 6 months, we might be able to save 10 lives with that ventilator. And their whole question was, if we don't have any more, do we take his ventilator and give it to those 10 people over time? And those are incredibly, incredibly horrible discussions. And they're tough because it's about maximizing it. So what I'm saying, at a population level, we have to be prepared to have these discussions. But ideally, what we want to do is get us to the point of where we minimize deaths, we minimize transmission, we maximize society, and we get ourselves a vaccine. And however you slice it, it's going to be tough discussions. Getting back to the question you just raised, let me just, say for what it's worth, because I'm just a soldier in the public health army. I have been for 45 years, and I salute the same flag and the same commander, regardless of who the public health leadership or the elected leadership are of this country. I've served in the last 5 presidential administrations. Even this one, I was a science envoy for the State Department for a year. I'm sure at the university. I served 2 Democratic governors, 2 Republican governors, and 1 independent governor in Minnesota, a state epidemiologist. And my family couldn't tell you my partisan politics when it comes to those issues. But having said that, I would agree with you 100% right now. Leadership is everything. We're going to have a really, really tough time with this situation. There's nothing easy about it. And I wish we had somebody right now that could do fireside chats. I wish we could have somebody that would just straight talk and just tell us what we know and what we don't know and what we're going to do to get around it. And, somebody's going to tell us we're going to have some hard times, but this is what we're going to do. So number one, I think if I had to do anything right now, is instill that sense of leadership, that sense of trust. This is not a partisan issue. I said 4 weeks ago, when this was starting to evolve into a red and blue state issue, a red and blue county issue, I said, you just wait. There won't be red and blue. There'll be COVID color. Look what's happening right now in rural America in the agricultural belt that were primarily red states, and see how this virus is sweeping through there right now, changing everything. Nobody's red and blue anymore in those counties. They're COVID. And so I think that's what we need, is that kind of leadership, first of all. Second of all, there are things we can do right now. This testing fiasco, we need to test, but don't let more people just come and say, test, 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 test. What happened was in December with Wuhan, there was a need for new reagents, the chemicals that run these tests, that were well above and beyond normal consumption for the world. But we were able to expand within the reagent manufacturing world to make more of it. But then when the whole world caught on fire and everybody wanted these reagents, instead of going from a garden hose, basically evolving into a fire hose, we suddenly needed a canal worth of these reagents. And today we can't get testing done because of the shortage. Where is our Marshall Plan that the United States could and should lead with the private sector to get these reagents? Instead, we have an argument every day about, is testing really available or not? Right. That's the kind of leadership we need right now.
And just to be clear,
need that.
Reagents are essentially the chemical that would allow you to take the sample from the swab and get it into a testing scenario. And so
exactly.
And frankly, you need to use the Defense Production Act to get somebody. I don't know what company it is. You might even have a better notion of it. You may have a couple of companies in mind who have the facilities and could start producing this stuff tomorrow.
Well, that's a challenge. First of all, if you were your whole business was around making widgets, and suddenly you're being made to ask mechanical ventilators. Ventilators, by the way, that on average have over 1,500 parts and come from a number of different countries, find machine parts. That's a challenge. But within the industry of reagent making, what do you do to ramp up? What does it take to build that extra capacity? And how do you do it? But you need that leadership. You need coordination. You need somebody to direct it, like a field general. And I could go through a laundry list of these things. The PPE issue, the N95 respirators, the same thing. And so that's the kind of leadership we need right now. I don't want to hear any more about how many products have been delivered that day, okay? Because if you're telling me you're delivering 2 million N95 respirators, that sounds great. But when you realize that the orders that were standing and needed immediately number 12 million, what did 2 million do? Right. I mean, it surely helped. But we need that kind of honest discourse and say, we're short here, but this is what we're going to do. You know, if you really want to understand where we should be right now, go back and listen to FDR and go back and listen to Winston Churchill. You know, they taught us how to do this. They told us hard things, but they told us how we're going to get through it. So that's where I would come from, and I would incorporate these kinds of issues. I mean, a good example right now, I'm a public health guy, okay? I'm fully acknowledging that. I think the lack of CDC's role in national policy discussions on modeling and all the things we do has been horrible shortcoming. And, you know, it's like going to war, but deciding because for whatever reason you didn't like the tank division, you're not going to bring the tanks in.
Right.
You know, that's not helpful.
And it's really, I think the proper analogy is you don't like the color of the tanks. I mean, there's a real sense that the way this thing is being organized is by the whims of, you know, with all due respect to my daughter, a junior high school kid, essentially, who is not really assessing what different it seems to be a function of just like, who's giving me bad news? You're out of the picture. But I know I have a couple minutes here with you because I know that you have a heart out here. Let me just ask you this.
Yeah.
What do we know about this disease now, particularly in terms of its transmission? I mean, should we be washing down? If I get a box from UPS in cardboard, should I be washing that down? Should I be doing that with bags? Should I?
Yeah.
I mean, what is the best practices that we understand now, and how has that changed over the past 2 months, let's say?
Yeah, the first, second, and third order of transmission with this virus is air, 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 and air. Okay? We now know that respiratory transmission is by far the major component piece of transmission. And it's not just air right around you. Unfortunately, it does include what we call aerosols, these things that you and I have been generating the whole time in this conversation. In whatever room each of us are in, we've pretty much got those floating around. Think about the last time you saw sunlight coming through the window in your home or your place of work, and you saw that stuff floating on it, and you thought, boy, this is pretty dusty in here. Those are aerosols. Those actually from you and I just talking. We create those, okay? And so that's a challenge. These are the same aerosols, by the way, when you go to a department store and you're 4 aisles away, you can smell the perfume section. And so that is a problem. This is a readily transmitted virus by that way. Some people transmit to very few people. We have some household settings where someone doesn't transmit to anybody. Then we have those situations where some people transmit to as many as 50 to 100 people. And so the transmission is variable. I think the question, though, that you really wanted to get at was those all that surface contamination. Do I need to wipe everything off? This plays a very, very small role, if much at all, in the transmission of this virus. The idea of contaminating a surface and touching it and putting it to your face. Clearly, your eyes do have receptor cells for this virus. They could become infected through the eye, but it really is a small role. So it is about breathing air, and this is where distancing does come in. If I'm not right in that same room a long period of time with someone, I have a much lower chance of getting infected.
If someone's in my car, let's say they're infected, and I come into that car 5 hours later, is the aerosol still in there? Does it make sense for me to go like, well, I'll get in the car, but I'm opening both doors first and I'm going to let it air out for 10 minutes?
Yeah, if somebody was in the car with you or before me, and they were infected, literally just opening the car doors and letting air through there, that'll dissipate quickly. That's what I'd be concerned about. I wouldn't be so concerned about, any other part of the car. Just letting that air out. That's important.
So, and the upside, I guess, of heading into summer is that people can, if they want to socialize and you're 6-7 feet away across a porch or stairs or on the street, and you're out in the open, that's a much better place to be than inside a room.
Absolutely. I just got an email this morning from a very creative father who wants to have his son's team play baseball this summer, and in light of our baseball discussion. And he had a very elaborate way to keep the kids apart, even to the extent that they have team balls for which one team handles, the other team doesn't, that kind of thing. Mm-hmm. The umpire stands behind the pitcher as opposed to behind the plate. To even have a catcher, you just have him stand back by the screen, pick up the ball. And he was really thinking creatively about how could we get these kids together and keep them apart far enough outside that, we don't just end that. And, that's the kind of creative thinking we need right now. I mean, I would say frankly, the risk is probably very low of that.
The biggest problem, though, is that, I do this, every day I read about this stuff. And there's been no source of information that has said, we're around the edges, air, but there's been no source of information that has said the simple things that you have said that, give me a sense of like where I should be most careful, where I shouldn't. Like, we just don't hear that. There's nobody announcing that information.
Well, we're trying. Okay. When we every day we focus on, do we have enough tests or not? Every day, when we focus on what's the source of this, whether it's a Chinese war weapon, intentional release, etc., we're missing exactly the points we're saying. I've been saying for 3 months, we are learning how to die with this virus, and it's horrible, it's painful. Personally, it's impacted me. But you know what? We have to also figure out how to live with it until we can get to the point of where hopefully we're going to have that magic bullet. So this kind of discussion we're having right now is exactly the kind everybody needs to be having about how do we live with this thing. And so I couldn't agree with you more. You're absolutely right. This is what we need for information.
Dr. Michael Osterholm, thank you so much for your time today. I can't thank you enough, and I really hope we have the opportunity to do this again. I know you're incredibly busy, and I really appreciate you taking the time.
Well, and I think you're having this conversation. It's people like you in our communities that can help legitimize and help put forward and actually demand this kind of conversation. You can demand this kind of, leadership as such. So I just want to thank you, and I hope more people take you up on the kind of discussions you're putting forward here. This is what we need right now. We need this. That's the leadership we're talking about.
Michael Osterholm, thank you very much. Center for Infectious Disease Research and Policy. Thanks again.